Are you excited for a fun learning session? So here's the content that we're going to discuss in this video. What is Tinel Test? Tinel sign was previously known as Hoffman-Tinel sign. It is used as a physical diagnostic in carpal tunnel syndrome and other nerve conditions. This test is said to be positive if there is a radiating pain or paresthesia. The purpose of Tinel test is to assess compression neuropathy, commonly in diagnosing carpal tunnel syndrome and other nerve conditions such as cubital tunnel syndrome and tarsal tunnel syndrome. In the procedure of Tinel test, firstly, the client is asked to flex the elbow on the affected side and supinate the forearm so the palm faces upward and the wrist slightly extended. Second, it is performed by light tapping. The anterior surface of the wrist at the point of median nerve passes through the carpal tunnel with 1 or 2 fingertips 4 to 6 times. The positive of Tinel sign is a tingling, numbness, pain or prickling sensation developed in median nerve distribution. The median nerve will affect thumb, index, middle, and lateral half of ring fingers. The clinical symptom of CTS, the client may have numbness, severe pain, tingling, or falling of the object, and frequent head awakening during night. The clinical sign can be assessed by Tinel sign, atrophy of the tinel eminence, and a Phelan test. The severity of CTS can be graded by mild, presence of only sensory symptoms such as pain, paresthesia, and numbness. Moderate, presence of motor symptoms such as weakness, and severe CTS is a presence of muscle wasting. Now, let's watch a video. Hi, did you know about the purpose of Tinel test? Tinel test is done to assess compression neuropathy and commonly in diagnosing carpal tunnel syndrome (CTS), and also other nerve conditions such as cubital tunnel syndrome and tarsal tunnel syndrome. So, let me show you the next video on the procedure of Tinel test in carpal tunnel syndrome. To conduct the test, the patient is in the sitting position with the forearm and hand placed comfortably on the table surface. Use 2 fingers with lightly tap at the carpal tunnel of the wrist for 4 to 6 times. Some authors recommend to tap along the entire distribution median nerve from the index finger to the middle forearm. The test is positive for carpal tunnel syndrome if tingling or paresthesia is felt in the thumb, index finger, middle finger, and lateral half of the ring finger, which is distribution of the median nerve. Okay, next, how about the other nerve conditions? Okay, I will show you in the next video of Tinel test being done in assessing cubital tunnel syndrome and tarsal tunnel syndrome.
Tinel sign is used to detect ulnar nerve entrapment at the elbow. To perform this test, have the patient's elbow in a flexed position. Supporting the patient's wrist with one hand, use the other hand to tap lightly at the medial cubital fossa. A positive test is reported when the patient feels paresthesias along the medial aspect of the forearm and/or into the medial 1.5 fingers.
The tarsal tunnel Tinel sign is used to detect tibial nerve entrapment at the tarsal tunnel. To perform this test, tap posterior to the medial malleolus. The test is positive if it produces paresthesias in the distribution of the tibial nerve.
That's all from me. Hope you gained something. Thank you! Based on a study Anissa et al. 2021, Tinel test is a provocation test in diagnosed carpal tunnel syndrome (CTS). Based on a study on 2019, it shows the high sensitivity from the 3 tests was Drucken test, Tinel test, and a Phelan test, and the highest specificity was seen from the Drucken test, Phelan test, and the lowest was the Tinel test. Based on a study on 2018 by Aval et al., the specificity and the sensitivity of Phelan test shows higher than the Tinel test. Next, Positive Tinel sign at the tarsal tunnel is a valid measure of tibial nerve abnormality, as the study shows significantly more neuropathic symptoms and higher sensory threshold. And the other study of 192 patients diagnosed with ulnar neuropathy at elbow shows sensitivity 62% and specificity 53% of Tinel Test. Lastly, Bai Chang et al. 2008 for carpal tunnel syndrome shows lower sensitivity in Tinel Test rather than the other tests. For conclusion, the Tinel Test is to assess compression neuropathy, commonly in diagnosing carpal tunnel syndrome and other nerve conditions. The positive of Tinel sign is tingling, numbness, pain, or prickling sensation in the distribution of the nerve. Thank you.